Thank you. Good morning, Brittany. How are you? Hi. Can you be a part of it though? Or no? Okay.
I want to do my arms.
It's incredible.
If you need to
So,
practice, you just let me know.
yeah, well, actually,
Just
I will.
about
There's
the
going to be a
letters.
few that will be working.
I've been like this.
If you have time between,
Tighten up, and
they're
then
going to
you
be
get,
here till 8.
cut, like right where you're,
So patients are
maybe
coming
tighten
through.
your muscle up here. Yeah. So you get a cut right along in here, so that when your arms are up, you look like you'll have muscle definition.
Oh.
It's really amazing. And
We're
he does.
8:15 today, and the
Most of
schedule
these
should be
trainings
reflected.
He's done 3, but
We
most
blocked
of
it.
it takes about 4 hours.
Well,
Destination.
Q, do you know if they're on or not?
It's different from this. You just have to log on to YouTube.
So do you know if they're on though? They're watching?
Oh, we got one person watching.
So that would be them, right? Probably? Okay. Hey, Megan? Megan, no. Oh my God, Jesse, I just called you Megan. Could you check that? Can you text Megan and see if she's on? Because there's one person watching. Yeah, and that's okay. That might be them. I just want to, before we can. Oh, good. Yeah. Okay. No,
Oh, no, you're fine.
I'm just, I know that they have patients getting started, so I want to make sure.
Live? Okay.
Can you keep it on speakerphone?
Do we need
until-
this? This is so loud. Oh, they can't hear me over there. We're live streaming. Yeah, so it's a little bit different than what we used to do.
Testing, 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 testing. There you go. Is that better?
Are we ready? Is everyone here? Katie? Do we have everyone? Okay. Good morning, everyone. And the only reason I'm going to talk into this microphone with this small group is so that the Livonia team can hear us because we are live streaming with them this morning. So we are going to talk to you a little bit about the Vein Marketing Program. Okay, this is really important information that we want to make sure everybody is aware of some of the stuff that we're doing to try and help build the vein business around here. So for starters, let's just talk about these doctor referral letters. Who here is aware that we like to communicate with the physicians of our patients and the ones that refer patients in? Do you guys know why we're doing this? Okay. I think that we made a big mistake when we started this program a couple months ago. We should have done this back in, I don't know, whenever we started, like October, to let you guys in on a little secret, which is why we're doing this stuff and why we've chosen to add an extra layer of work onto your busy days. I don't like to do that. You guys know that we view ourselves as support staff. We're not here to try and give you more tasks to do, but there really is a very important purpose behind this. But before we go and look forward, let's go ahead and take a look backwards first. We're asking you to help us with generating physician referrals. Here's why, but most importantly, we're going to go through the how, and Joanne and Eric are going to take you through that this morning after I give you a little bit of the history about the VEIN program. So in the past, the main sources of new VEIN leads have been, as you're probably well aware, TV, newspaper, pamphlets. We also have had direct mail. We've done radio. We've done a lot of things. And some of this stuff we're still using. We are still using some of these traditional forms of marketing. We've got TV still out there. We still have, obviously, our brochures. And occasionally we'll do a direct mail piece or a newspaper. But we've scaled that stuff way back. Here's a look at what some of the stuff used to look like way back in the day. I think I pulled these from like 2006. So we've obviously elevated the brand a lot since then. But here's an example of like an old newspaper ad. And this stuff was awesome Dr. Moak actually, I think he put a lot of this together himself. He'd put this into the newspaper, and people would just come when the company had enough money to start going on a television. It was amazing. The phones rang off the hook, and they were so busy that obviously it propelled the growth that we're experiencing today. So in the past, there were very little competition. I think one of the other things to notice is back here, it's just us in this picture. There's really no one else. Month after month after month, record sales, more people coming in, more people responding to the stuff that we were putting out there. Today, that's a different story. This is just a quick survey of some of the other competition that's in town. And not only are these people in existence, they are on TV, they're in the newspaper, they're in the direct mail, they're on the radio, they're kind of everywhere. I think these guys, Metro Vane, they've got billboards all over town. We've got billboards all over town. So as you can tell, it's getting a little bit tough for us to keep getting that message, because let's say that we were competing for 1,000 people, and 1,000 people back in 2004 were seeing our message. Now they're seeing all of these people and us. We're still there, but it's just less effective than it used to be. We've noticed this trend over time. So it's really, I guess, how do I put this? It's getting tough for us to break through the clutter. I read a statistic one time that said the average American is exposed to 3,000 forms of advertising and marketing every single day. Think about it on your way to work. When you go to the gas station now, have you guys seen the little TV screens that they've got out there? They get you in the bathroom. You can't go anywhere without us marketers trying to get into, your mind and make you aware of us. So it's getting harder and harder for us to keep these results up with the program that we have. So in response, we're spending less. And this is something that I want to make sure you guys know is going on, because it's going to make sense about some of the stuff that we're asking you to do. Back when I got here in 2013, our TV budget was around $782,000. This year to date, I've only spent $238, and it's going down every month. Last year versus this year, I'm spending 40% less on TV than I did. That means that we're not trying to find the vein patients on television anymore. I mean, we still have our ads out there, and the ones that we have, we buy effectively, they still work, but it's just not what it used to be. So we have two choices here. We can either, rub our hands together and go home, or we can figure out a different way to play this game. And I think that we found a pretty good way to do this. We still need our vein patients. So what does the future look like for us? Well, you guys know that we've got the referral contest going. Do you guys know how close we are on that, by the way? We need 14 more referrals. If we can't pull this out by the end of the week and get our free vacation day, then I don't know what. But this is going to be something that we're building more and more, and we've got more ideas about how we can make this possible. So this will be stuff that we're unveiling over the coming months. But the doctor referrals are really where you guys come in, and this is something that we've tried to get off the ground. And I think that, the liaisons are doing an amazing job of getting those references for us. But we can tell you, and we actually have Dr. G here today who can attest to this, the doctors want to hear from the doctors. The communication, we've done our research on this. I've read the blogs. I've, talked to these companies that, give advice to people in the liaison jobs, and they all say the same thing. We have to communicate with these physicians, or those referrals will absolutely dry up. I know Michelle, she's not here right now. She had a doctor tell her, if we don't start getting letters from you guys, we're not sending any more patients your way. And that's a scary thing when you take a look back here, and we know we're not going to get these leads anymore. So our source is these doctors, and it's a really important one. So we are going to get into the how we're going to run this program, but hopefully this explains to you a little bit more about why and why it's so critical. And it really is the future of our success. So I'm going to turn it over to you, ladies.
Thank you very much. No, I don't. I don't have any slides for you guys this morning. I know we've talked about the purple referral documents over and over and over again, so I know that you guys are all familiar with the purple documents, but I do want to touch on how we are going to get these letters generated. When these patients are identified with the purple sheet, we kind of change the way we're doing things, whereas now if a patient is referred or is not referred by a specific person, they're getting a letter sent to that PCP. So we already have that step taken care of. So when you see a patient that comes in for a vein consultation, we already have a letter that's generated for their doctor that we automatically mail out, so you don't have to do anything, okay? You do want to track the purple physician referrals still in NextTech. So if you see that, that's a good sign. Keep that document in the chart, because when the patient comes back for their ultrasound, we want to make sure your doctor that's going into that ultrasound knows that this is a referred patient and who this thank you letter or mapping ultrasound is going to. So it's very important to make sure you pay attention to the file prior, and I know you guys do. I know you guys go through, flipping through all of those documents that are in there, but it's really important to identify the difference between the two. So when you're on the floor and you have your mapping scheduled for the day, your doctors are going to go into that room and they are going to dictate a letter on every single mapping, every single one. If there's a purple sheet, that's just showing that doctor who that letter is going to. If there's a PCP sheet in that file, that's just showing your doctor where that patient, where the letter is going. So that's the difference. Okay, so that's the change that happened last Tuesday. So vein consult, don't worry, you don't have to create anything. Mapping, provider dictates the mapping, and then your 2-month, 4-month after their EVLAs, those letters still stay the same, how you've been doing them. But we need those to be consistent. So you have a patient who says, no, please do not send any further correspondence to my doctor, fine. But you have patients that say, yes, we need those letters generated. So I worked with Katie in the past, and we're just going to have to work really diligently on making sure that every patient at the end of the night has a letter created in the file. And then, Jackie is still printing off those letters and sending them out, or handing them up, handing them to us. And then lastly, we have our vein completion letter, and that's rather new. Probably in the past month or so we created it, but we want to make sure that you're aware of it. It's in the same area as PCP letters. It's just called final completion letter, and that letter needs to be generated to send out to all doctors, explaining to the doctor exactly what happened, the course of treatment. Those of you that are not familiar, if we need to have a separate training on it, please let us know. Or if you have time throughout your day today, please see Katie. Are you here or in Clarkston? So she can show you. I'm not familiar with that letter myself. I just know it has a lot of information pertaining to their visits with us in the past year. What happened, what we did, the results, and things like that. And that's a very important letter that we, go off to the patients to show the doctor exactly what happened throughout the course of treatment and how happy, how the patients resolved in their, their varicose veins and things like that. So they want to see the results from it. So that is your final letter you're going to send out. So instead of the final PCP letter, the final completion letter is the letter now you're going to use for all patients at the end of treatment. So you're going to create the letter. Jackie's going to proofread it, print it off for that doctor to sign off on, and then we're going to take that letter, go to our car, and drive it to the doctor's office and thank them for that referral with a nice box of chocolates. Delicious chocolates. I didn't have any. I'm just saying. They're really nice. Of course. Katie has a question. One moment.
Dr. Moak discussed last week, he wanted a letter to go out after they have the mapping with our plan, like saying that we found reflux and stuff, and I made one in NextTech. Now, are we doing that, or is he physically dictating? Because I was told he wanted me, that's the letter we're going to use. Okay. Yes. Okay. Let's do it. He had me generate a letter that is to be used after a mapping. So, like, we see the patient for the consult, and we do the mapping. We find, all of our findings. We put it into this letter, just kind of breaks it down. We list the patient's symptoms, their treatment plan going forward, and then that they would be hearing from us as the treatment goes on. So I've already, it's in NextTech. It's already a template. So we'll figure that out, and we'll let you all know.
So I think what's going to be really important important, and maybe another email will go out. So if you see this, please read it. Maybe we're just going to list out all the letters that we're currently using, so that you guys, because I know when I go in the folder, I'm like, whoa, whoa, whoa. There's a lot of them, and that's good because it's you probably use them all. But maybe let's identify the ones that we need to continue to use and the ones that we may not need to use anymore. That way, you guys have a better understanding of what letters to select when you're generating them.
My question is, would you want us to print them off and give you guys copies and go through these with you, or do you want us to email it out to you? What's the easiest way for us to communicate this information to you so that there's no confusion? We really need your feedback. Email's okay? Okay. Okay. All right, no problem. If you want both, we can do both. That's fine too. Yeah, did I mention there was going to be a quiz? You guys, there's prizes at stake here. Katie, can you answer that one?
Yeah, they can dictate later. They don't have to, because not every doctor is going to get in to sign off on all the mapping, so they can dictate later. There needs to be some kind of tracking system, I think, too. We still need to put in place because these charts, I know Dr. Ace having the same problem with charts of feasibility.
Yeah, we did find that. We've actually, if they're tracked, the good thing about that is if they're tracked in Nextech, we're looking for where is that letter, and so is Nancy, so she's helping us find that. So if you Okay, so we're taking a few minutes to answer some of these questions on the pop quiz. And for Livonia, well, so for Livonia, I'm going to read off the questions that I have. We have some gift certificates that we want to, gift cards that we want to give out to the winners. But we'll read off the, yes. Okay. Oh, okay. Okay. Hey, Livonia, it's Joanne. So we're doing a pop quiz right now, and I, for some reason, was not able to, believe it or not, forward this pop quiz to you guys. So what I'm going to do is read off the questions, and if you know the answer, please text me or speak through the phone, okay? I'm sorry. I will ask you guys 2 specific questions. How about that? Let's make everyone's life easier. Okay, so are you guys all done with the pop quiz? Okay, so this question's for Shelby Township. Who should be called to go into a mapping? Go ahead, pull them. Ding, 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 ding. Okay, so the answer is doctor. So the question was, who should be called in to go to a mapping? A, nurse practitioner, B, doctor, C, PA, or D, doesn't matter. And the answer was doctor. Okay, this question's for Livonia. What is the purpose of asking patients if they were referred by a provider? A, so we can send them mailers. B, to thank them for referring and communicate with them during the course of patient's treatment. Or C, to flag the doctor to call them. vein follow-up if PCP referred them or if they have a PCP? I'm going to read. A, so we can send the doctor communication regarding the patient for future referrals. B, because it's required for every vein follow-up. C, because we need to make sure it's entered in NextTech. Or D, all the above. That's correct. D, all the above. Okay, they're not listening anyway, right? We have one follower? Oh, that's well, we tried. Next time. Okay, so this one is for Livonia. At a 6-month follow-up, we identify a patient was physician referred. What do you do? A, send a 6-month follow-up note to referring doctor. B, verify in NextTech that physician is entered in referral source. C, enter referring doctor in general 2 in NextTech. Or D, all the above. Yay! Good job, that's correct. D. All right, so for Shelby, completion letters should be generated for A, all patients regardless of the referral source. B, only physician referred patients. C, only if the patient requests a letter sent to PCP. Or D, we don't have a completion letter. Jesse? A. Correct. A. Ding, ding, ding. All patients regardless of the referral source. And lastly, in Livonia, where are the purple documents located on the shared drive? Oh, this is going to be hard without looking at it. The S drive in the folder called PCP letters. B, the S drive current docs referring Dr. Purple form. C, shared drive Allure staff folders purple document. Or D, S drive current documents front desk miscellaneous folder referral thank you template. D is in dog? Yes. You are right. Ding, ding, ding. All right, guys, good job. Thank you so much for listening. Sorry about the technical difficulties. I don't know what happened to my link queue. But anyway, I hope you guys have a great Tuesday.
Thanks, everyone.
And then you guys are, we owe you 3 gift cards. So I talked to Lisa about it, so get your gift cards from Lisa. All right, thank you. Uh-huh.
Oh, I don't know.
Hi, good morning.
We'll get them in Livonia.
Oh, yeah, you know what? I think I'm going to be there Wednesday afternoon with Mary. I'm sorry, I saw her email, so I thought you were, I'm sorry. Okay, yeah, so Wednesday is tomorrow. Okay? Okay, bye.
Am I talking to someone?
No. Did that clear up anything?